and to try to start putting some guidelines together to advise people how to reduce the risk as we start discussing what the plan could be for reopening the city while we're watching our numbers. So I'm asking you to consider your mindset. Are you thinking about yourself and worried about how I could get sick, how I mitigate the risk to keep myself healthy? Or is your mindset about our community and how just my movement around the community could affect how it spreads to you, to your family, or to someone that you love? So I challenge you on those mindsets, and I want you to know the City Council will be working hard this week on a plan that we hope to be able to communicate to the city sometime next week about what it might look and the phases we might have for a possible reopening. Thank you.
Thank you, Mayor. This time I want to go ahead and turn to Casey Stoughton, Public Health Director, City of Amarillo.
Thank you, Dave. As of yesterday, there were a total of 255 cases of COVID-19 reported in Potter and Randall Counties. We will have additional cases reported on our 2:30 report card. Our team is busy tabulating those numbers right now. We have a total of 42 recoveries, which is certainly something to celebrate. We do have 7 deaths reported in Potter and Randall Counties. Our drive-through testing center remains open today until 3 p.m. So if you're interested in being tested, please call 378-6300 and our call takers will screen you and send you to the testing site. I do want to remind our community that the only way to slow COVID-19 is to stay socially distant from others, to wear a mask if you have to leave your home, to wash your hands regularly and often, and use hand sanitizer if you don't have access to soap and water. Thank you, Dave.
Thank you, Casey. Now I go with Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, thank you. First of all, I just want to repeat what Casey is stating, is that we have to remember to be mindful of social distancing, trying to stay home if possible, washing our hands, and wearing a mask if you have to be in public. That's just the most important thing to reduce the transmission of COVID-19. To date, there have been 4 recipients of convalescent antibody, 2 over the weekend at Northwest Texas. Coffee Memorial is ready to receive donors. This should begin today. And I expect the need to continue to increase for a convalescent antibody, and we hope that our donor pool will also increase over the next several days. And finally, I'd just like to say that we're watching the numbers closely, not only in the community, but in the hospitals. And we have had an increase in cases in the hospitals over the latter part of this week and into the weekend. We are closely monitoring this, and I'm in constant communication with the hospitals concerning this. Thank you.
Thank you, Dr. Milton. Now I go to City Manager Jared Miller.
Thank you, Dick. Public safety calls for service remain down. Amarillo Police Department down 17%, Fire Department down 35%, and EMS ambulances down 15%. So again, thanks to the community for social distancing, doing your part to stay safe. That's all. These reductions in calls for service are directly related to people sheltering, people taking care of their social distancing and moving around less. AmarilloAlerts.com, as a reminder, we recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. I want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so that you can stay informed. As of this morning, we have 4,382 people signed up for these alerts, and that's just in a little over a week. So thanks for signing up. Thanks for taking the time to do that so you can stay in the loop on what's going on in town. As Casey said, we're still doing drive-through testing. I want to remind everyone that the drive-through testing center is still open. If you feel sick and have symptoms that you think may be COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. Finally, the Animal Management Welfare Pet Pantry has been extremely successful. On Thursday, April 9th, 547 families were helped, and yesterday another 497 families were last Thursday, another 497 people were helped. Please note that the event was canceled last Tuesday due to weather conditions. The program will continue this week, tomorrow, and Thursday. So Tuesday and Thursday this week, between 3 p.m. and 6 p.m., you can come to the AMW Animal Management Welfare, located at 3501 South Osage, to receive a free bag of dog food or cat food. I want to give, again, a special thanks to our partner, Merrick Pet Care, who has donated the dog food and the cat food for this cause. We couldn't be doing this without them, so true thanks to Merrick Pet Care. That's all I have.
Thank you, Jared. This time I want to go and turn it back over to the mayor very quickly.
Thank you, Dave. I had a question for Dr. Milton and Casey. I'm hearing around town that people are getting access to non-FDA approved testing kits. And I think I have some concern that those test kits are inaccurate and that they could be dangerous if someone got a negative test result from an inaccurate test, but they think they're negative, and then they're moving out in the community thinking they're negative. I could see how that could be really dangerous. So could you speak to whether or not you know are people in the community getting access to non-FDA approved testing kits, and what are the dangers of doing that?
I'm not aware of any testing kits that are not FDA approved. I don't know if Casey, if you can comment on that. I know that it may be confusing if there are newer test kits that are becoming available, and some of these newer generation antibody tests are being utilized. And I think what I heard over the last week is that there has been some concerns about how accurate those tests are. I do believe, though, that we are recognizing a positive test as a valid test, and we count that as a positive case if, in fact, it does test positive. As any new technology is brought to the market, I think it always gets refined and improved. And I think there's going to be some newer generation antibody testing that's going to be even better, and it's going to be available in the near future. That's by Abbott, is the company that's coming out with that. So I think that, in a more general term, I think that the more testing we do, the better. And so I'm going to encourage that for physicians, if they have the ability to test and screen patients, to continue to do so. And please let us know those numbers. Please report those numbers to us so we can have a picture of what's going on in the community.
And I think it's also important to note that even if you get a negative result, if you're sick, you need to stay home until you're symptom-free for 3 days. If you need to seek emergency medical care, then you need to reach out to your healthcare provider and let them know that you're on your way. But if you're sick, you need to stay home, or if you have symptoms, you need to stay home until you're symptom-free for 3 days, regardless of what that test result shows. If you're sick, you need to stay home. If you need to seek emergency medical care, then you absolutely need to do that. And then, like Dr. Weiss and Dr. Lamentier have mentioned it multiple times, if you have a chronic healthcare condition, or if you're experiencing signs and symptoms of a stroke or a heart attack, you certainly need to seek medical care, because the risks of those conditions far exceed seeking emergency medical care. So if you have a chronic condition, certainly seek attention for those.
Thank you.
Thank you, Mayor. At this time, we want to go ahead. We do have some questions that have been submitted to us by the media. I think this question probably applies to everyone on the panel, so feel free if you have information you want to use to answer this question. This is from KVII Channel 7. As the city set up a timeline and benchmarks for reopening businesses in town, will some types of businesses be allowed to open sooner than others? And what will be a trigger to start this process?
I'll start. And the answer is yes. We're currently working on that. I think it will be a phased reopening. It's not so much a when, it's a how. And watching the numbers as our numbers are continuing to decline. They have not begun to decline yet. So that is one of the most significant components, as well as hospital capacity, our ability to continue testing. New treatments. Are there any new treatments coming out? It's relevant that we have this antibody, convalescent antibody treatment now available in our community. So there's a lot of factors there to be considered. But I think folks should expect that we want to do it safely. We want to do it as quickly as possible, but we must do it safely. And it will come in phases. It won't just be like a light switch, we're all back on. That's my opinions. Panel.
Thank you, Mayor. At this time, I want to go ahead and turn it over to direct questions from our media members who are participating. Let me start first with, I think I have this right, Ariana Martinez.
And we'll continue with coronavirus coverage on air and online. And to keep up with the latest and watch the rest of the meeting here, you can go to our website at myhighplains.com. Back to regularly scheduled programming.
For the families, the age ranges for each of the deaths range from 49 to 96 for all of the deaths total.
Okay. And then do you have individual ages for those?
I don't, not today.
Okay. And then a follow-up question from Friday. Do you have the numbers of how many positives in our nursing homes?
No, I think what's most important, rather than specifics, is that we want to create a safe environment for our essential workforce so that they can care effectively for our residents in nursing homes.
Okay. And are any of those deaths from our nursing homes by chance?
Again, I don't have specifics. As our numbers grow, I lose visibility on the specifics of each of the cases, but we do certainly want to make sure that each of the healthcare facilities and the first responders and the essential workers have the resources that they need so that they can safely care for each of the residents in those nursing homes.
Okay, thank you. And this question for City Manager Miller. You might not have these questions, so it might have to come back. But I know in other cities, the amount of traffic tickets from people speeding is going up. And I know I've personally seen people doing street racing here. Do you know if our traffic numbers or traffic ticket numbers have gone up by chance?
No, we're still doing enforcement. I do not know. I don't have that data on me right now, but we will find that and give you some year-over-year data to see, to look at that. I don't know that information. I do know, however, that we are still doing all enforcement, all traffic enforcement activities are continuing.
Perfect, thank you. And for Dr. Milton, it seems our numbers are rising a lot faster lately. Do you know if we are at the peak or maybe reaching the peak?
Yes, I think our numbers are rising, and I don't think we're at the peak yet. I think we'll just need to watch the data and the numbers as they come in. Now, when will that be? I think it's probably relatively soon. But we're watching the numbers not only in our community but also in other areas of the Panhandle. That's important to us because we are a big referral center for a lot of these smaller towns out in the Panhandle. Not only that, but in New Mexico, Colorado, et cetera. So we have to be very aware of what's going on in other parts of the area just outside Amarillo as well.
Perfect.
I would speak to that a little bit too, just asking our rural partners, our small town mayors and our small county judges to, I know y'all are watching your numbers too, but this is something that we're all in together because we do share our major hospitals. So your numbers are our numbers, just like your neighbors are our neighbors. And so we are asking all of you to be extremely vigilant with your social distancing, whether you live in a small rural panhandle town or whether you live in the heart of Amarillo, we all need to be making those choices to social distance, to wear masks, to operate your business with a 6-foot distance between employees and customers at all times. Just our hospitals are a panhandle resource. And so it is absolutely true that we're watching numbers all across the panhandle when we gauge what kind of capacity we have in our Amarillo hospitals.
Perfect. Thank you, Mayor. And this question is actually for you. I know you only did one roundtable meeting so far, but what were the major concerns or topic points that you guys talked about during that first industry roundtable meeting?
A lot of the conversation has to do with what do we think people will be willing to, how will they govern themselves? Will they be willing to wear a mask in order to keep other people safe? It's not so much about wearing a mask to keep yourself safe, but it's about wearing a mask to keep other people safe. Are you going to, can you change your operations so that no one ever comes within 6 feet of an employee and that employees can stay 6 foot, distant? So a lot of it's just operationally and how long can they sustain an operation like that? So the conversations were about what do we do in the next 30 days to craft a plan that would allow us to begin to reopen the city? And what do we do over the next 18 to 24 months to economically recover from what it's costing us in our economy? So again, it's the two things we're struggling with. Number one, we want to be safe, and number two, we want to be working where we can be safely working.
Perfect. And this kind of is the same kind of question. Are we following the exact dates that Governor Abbott has for certain things opening, or are we still kind of weighing those numbers first?
Well, we are absolutely submitting with what the governor is putting out. We're giving grace too, because they're dealing in real time and their data is changing and they're trying to craft a plan that gets Texas working as soon as possible. So they have rolled out some changes for businesses that can open as soon as, of course, state parks open today. And then April 22nd, some non-essential surgical procedures will begin again. So they're trying to figure it out, and as quickly as they can figure it out and we can turn around and process it, we're trying to incorporate it. So we appreciate the grace and the patience. We've had tremendous patience and grace from business owners here in our city. And I'm so proud of our community. And I really do appreciate, we just need a little bit more grace, a little bit more flexibility. And that's going to be the name of the game, name of the COVID game, as our community responds in the coming months.
Thank you, Mayor Nelson. And going back to Dr. Milton, so far we've had 4 people use the convalescent antibodies. Have you seen any progress from them yet?
So the most recent ones that we gave were over the weekend, and those individuals are critically ill, and I haven't actually been by the hospital today to personally check on them. So that's the most I can give you about that. The other individuals over the last weekend, I believe, did see some improvement, but I don't know that I can give you specific numbers about that either. I will say that this is one of the treatments that seems to be, and maybe the only treatment that really has some data that shows that it can be effective in critically ill individuals. So we should know more about the data as time goes on. We're involved in a study through Texas Tech that's kind of coordinated nationally through the Mayo Clinic, and so we're contributing to all that data on a national level.
Okay. And then the number of patients in the hospital you said was rising. Is there any particular age group that is rising in the hospital, or is just kind of all over the board?
Well, what you're seeing is, there's some trends that concern me. But what you're seeing time and again are the individuals that get most sick are those that are prone to getting sick. They are people who have problems with the diabetes and chronic medical problems. Many times they're overweight, they're elderly. And so as we've said from the start, this tends to, and minorities, and we have seen that as well. And so we as we've said from the start, this tends to go for and make the individuals that are most vulnerable the sickest, and those are the trends that we're seeing.
Perfect. Thank you, guys. That's all I have.
Thank you, Ariana. Now I want to go to Jack Kessler, KAMR Channel 4. Good morning, Jack.
Morning. So this first question is for Mayor Nelson. How are the roundtables with businesses going so far? I know you guys had your first one on Friday.
I think they're being very well received. Of course, we're dashing around to set those up because we're trying to do them in such a compressed time frame, and we've had tremendous response and cooperation from industry leaders as I've reached out to faculty at WT and heads of industry local groups. Everyone just jumping right on board and saying, who can I contact? How can I set it up for you? So that we can get those people who know what we need to know into the meetings and hear their opinions, hear their needs, hear their ideas for how we should move forward. I know the decisions that we make right now, even though we're doing them in a compressed time frame, they will have long-term consequences. And so I want us to use as much data as we possibly can, as much citizen feedback as we possibly can to feed into making the wisest choices that we can for the longest impact in our city.
And who have you guys met with so far? From what businesses, if you can say?
Yeah, I'm actually, because it's all spread out among the council, Jack, and I'm not allowed to talk through, Open Meetings Act, so I don't have that up-to-date information. It's moving too quickly for me to be able to accurately answer you that.
Could you say what industries maybe you've met with so far?
I don't know. I don't have that information.
Okay.
Mayor, we've had a lot of industries assigned out to different council members. We've had meetings with realtors. We're working with construction companies. We're working, or entities. Another council member's meeting with hoteliers and industries, all economic development, industries all over the community. So we're trying to be as exhaustive as possible as we reach out to different market sectors and industries to get their input, because we want to make sure that we're listening as much as possible to the input of our community, especially the businesses that we're talking about opening.
Mm-hmm. And I can tell you, Jack,
expanding their opening.
I'm meeting this week. I have more of an ag focus, so I'm meeting this week with people in the dairy industry, people in the beef industry, people in the production agriculture industry, and people in the oil and gas and energy sector.
Okay. And in Governor Abbott's plan to reopen Texas, today, of course, Palo Duro Canyon will be reopening with some guidelines. What does this mean for this area?
I think it's a possibility for us to begin to recover some as people begin to move around. We're not going to get on airplanes and go on summer vacations like we used to. But I do think that Palo Duro Canyon will be a destination for regional travel. And so again, this is going to depend on how well we as citizens individually adopt hygiene and physical distancing. And if so, then we can have access to things like Palo Duro Canyon. You could come from Guyman and spend 2 nights in Amarillo at a hotel and go to Palo Duro Canyon if we're doing physical distancing, if we are washing our hands, if we are not touching our face. So it's going to come back to us on how well, how many opportunities we have to operate normally. But I do think there's a possibility for that to impact our tourism, our restaurants inside our city as we move into the summer, and hopefully our numbers begin to decline and we can have more freedom there.
And this last question is for Casey Stoughton. Are there any cases are any of our cases from Moore County?
think we may have lost Casey there for just a second. Hold on just a second. We'll try to get her back.
Dr. Milton, I know you can probably take a stab at that question because
Sure.
we only get data for Potter and Randall County.
Sure, that's true. Yeah, so we don't track specific data, but I think there's plenty of public data that shows that Moore County does have significant cases. Yes.
All right, I have no further questions. Thank you, guys.
Thank you, Jack. This time we want to move on to Lamaya Harville, KVII, Channel 7. Lamaya, how are you?
Good morning. Can you guys hear me?
Yes, ma'am. How are you today?
I'm doing good. Thank you for asking. My first question will be directed to Casey. Casey, as of Friday, I was informed that there is only one African-American person and 6% of people, one African-American person has died from coronavirus and only 6% that make up those contracted that are people of color. Is that still the same or has that number gone up?
That's still the same. I think, especially of the deaths, those numbers are too low to draw any conclusions at this point. So I think that's a point that we certainly want to make.
And then also, Casey, just because we haven't reached our peak yet, and the NAACP has, and that will kind of wrote a statement saying that people of color are disproportionately, they reside in densely populated areas. Do we see, or can we predict anything happening with a widespread of cases coming from communities of people of color specifically?
I think right now, the numbers that we're seeing reflect the numbers in our overall population. We do need to do some more statistical analysis. I think it's important to note that our team is working very hard with the influx of cases that we have, and so it will take us time to do that more in-depth statistical analysis.
Okay, thank you. And this next question is for Dr. Milton. Dr. Milton, you kind of touched on some trends that we see specifically in minorities when it comes to underlying health issues. Can you talk to me about some of those issues that we see that are prominent in the Black and Brown community that could be a factor in deaths of COVID-19?
Yes, I mean, I think that generally as a rule, if individuals have medical problems that are not well controlled, or if they have housing that doesn't allow them to socially distance, or if they have the type of job that puts them in a position where they'd be increased at risk, whether that be where they're having to congregate, et cetera, then I think it's those kinds of things. It's these socioeconomic issues. I don't think it's a biological issue at all. I think it's a socioeconomic issue that puts minorities at increased risk. And therefore, I think from our point of view at the health department, it puts an added sense of responsibility that we need to try to protect those individuals as much as possible. And also be sure that we're educating them. That let's make sure that we're understanding everyone, that they can understand us, that we need to practice these types of things that will decrease the transmission.
And then do you believe that, well, several people of color have lack of health care or, the opportunity to see a doctor for various reasons? Are we doing anything in our city for Potter and Randall County to make sure that those who don't have the best of health care are still able to get tested and see a doctor if they have those symptoms of the coronavirus?
Yeah, I mean, I think that's our mission at the health department. Has always been our mission is to try to provide health care for those individuals that don't have the type of access that other people with insurance have. So that's been our mission from the start, and we're always trying to discuss and improve ways to better that access.
And testing site, Lamaya, our testing site, so anyone can be tested. So 378-6300 is the number if anybody needs to be tested if they're symptomatic, and then we can direct them to that testing site. And so that is conveniently located.
Thank you so much. And for both Casey and Dr. Milton, do we have any idea as to any underlying health diseases that are prominent in our Black community specifically that can cause the death if someone has, say, diabetes or diabetes in general? Is there anything that is linked to, you know, if you have this, you can have serious issues when it comes to coronavirus, or we just don't know at this point?
Well, I think the picture's becoming more clear, and people who have underlying cardiovascular disease, whether that be chronic lung disease or heart disease, if they have diabetes or if they have high blood pressure, if they have if they're overweight, I think those are all the significant risk factors health-wise.
And not necessarily to get the disease, but maybe to have
yes,
more complications from.
Absolutely. Well, those are all of my questions. Thank you so much.
Thank you, Lamaya. Now I want to go to David Gay of the Amarillo Globe News. David, are you there?
I am.
Good morning.
Thank you so much. Good morning, everybody. I just have a couple questions for Dr. Milton. You said there were 4 recipients of the convalescent antibody. Do we know how, I guess, did that all come from one donor? Did it come from multiple donors?
So it came from donors, actually still from our friends in Oklahoma. And so we're very grateful for that. It's still in short supply. We had another request for a 5th donor yesterday, but because it's such in short supply, it's probably not going to be until tomorrow where we may be able to get antibody for that individual. Now, that being said, our first cases here were documented around March the 18th. And so you need about 3 or 4 weeks of recovery and to be screened where we would screen them again and have potential donors here locally. Those numbers are starting to improve this week. And so we're actively following up with those patients at the health department, asking if they would be willing to be screened again to be a volunteer for a donor.
And I know you spoke about this last week, but overall, have people been pretty open to being willing to be a donor in this case to help those?
I think, Casey may be able to comment on this as well, but I think that people are generally enthusiastic about that.
Yes, David, they have been. They've been glad to be able to help their fellow citizens, and so I think it's really good that we're having that good citizenship, and so we need to continue down that path. And then also, I think it's important to wear masks so that we can again help protect others. So it just kind of all plays into that part of protecting one another.
Absolutely. And I guess the last question I have is, you spoke a little bit about the increase in hospital cases in the latter part of last week, as well as in the weekend. I mean, is there any specific reason for that? I mean, are any gatherings, any specific, maybe not following social distancing or anything like that has caused that?
So I think as we see the cases increase, we'll see, those numbers increase as well. Dr. Milton, you might have additional comments to add.
Yeah, I think the problems that we've had going through this have been related generally to people congregating, whether voluntarily doing that or in a manner where they just don't have a choice. And so those are the kind of trends we're seeing for the most part. Now but we're also having, generally some cases in the community that are just through local transmission. But okay.
Mm-hmm. That's all I got. So thank you.
David, thank you. Those are all the media questions that we had for today's news conference. Once again, City of Amarillo does this every Monday, Wednesday, and Friday, beginning at 11 a.m. I want to thank all our panelists for joining us today and taking the time to join us. And for everyone who's watching, thank you. Again, we'll be back on Wednesday at 11 a.m. Thank you.
Thank you. Bye.
Bye.